Today, I invite you to embark on a journey into the fascinating and often perplexing realm of body-focused repetitive behaviors. Picture this: a world where the mind's impulses intertwine with the body's reactions, giving rise to behaviors that can both comfort and torment. In this exploration, I'll be shining a spotlight on one specific behavior that encapsulates the intricate dance between compulsion and control: skin picking, a phenomenon known as dermatillomania. This term encompasses a specific category of compulsive actions that can lead to self-inflicted harm. This action has an officially recognized designation in the Diagnostic and Statistical Manual of Mental Disorders, DSM, as excoriation disorder. This behavior isn't a mere random act. Rather, it's driven by an overwhelming urge that compels individuals to engage in repetitive skin picking. What sets these behaviors apart is that attempts to cease them are usually short-lived, as they stem from a compulsive rather than an impulsive drive. The intricate nature of skin picking and its impact on mental well-being has led to its recognition as a distinct disorder. In addition to skin picking, there are other compulsive body-focused behaviors that I will delve into later in this discussion. However, for now, the focus remains on the world of dermatillomania, which stands as a recognized disorder in the diagnostic manual. Dermatillomania involves the persistent and compulsive urge to pick at one's own skin, resulting in the creation of sores, scabs, and potential scarring. This behavior predominantly manifests in common areas such as the face, hands, and arms. Individuals often employ their fingernails for picking, although some might resort to tools like tweezers or even engage in the act of biting the skin. Biting is particularly observed in individuals who bite at their hands or cuticles, a coping mechanism that may arise during activities such as writing or engaging in thought-intensive tasks. While some individuals may focus on targeting specific imperfections like pimples or bumps, others engage in picking at seemingly healthy skin until it becomes compromised. The satisfaction derived from this act, however, is often short-lived, giving way to the need to repeat the behavior in a cycle that's both distressing and challenging to control. The compulsive nature of dermatillomania lends itself to an intricate web of behaviors. For instance, individuals might manipulate scabs or engage in playful behaviors associated with the resulting skin irregularities. The act itself can be time-consuming, with some individuals spending hours engrossed in the repetitive cycle. An additional layer of complexity arises from the inclination to hide these behaviors from others, further isolating those affected. Much like its counterpart, trichotillomania, compulsive hair pulling, dermatillomania often emerges during adolescence, around the onset of puberty. It's characterized by a chronic nature, with episodes lasting for weeks, months, or even years, punctuated by intermittent periods of remission. The severity of this disorder can range from mild to severe, with implications extending beyond the physical manifestations to encompass psychological distress and the interference of daily functioning. In mild cases, individuals might find themselves engaging in skin picking occasionally, without a significant impact on their daily lives. However, even in these cases, dissatisfaction with the behavior is common. In contrast, severe dermatillomania can lead to substantial complications, including skin infections, scarring, and psychological distress. These impacts highlight the need for effective interventions that can alleviate the distress associated with this disorder. The management of dermatillomania varies based on the severity of the condition. Mild cases might naturally resolve over time, especially if individuals learn to recognize triggers and employ distraction techniques. For more pronounced cases, therapeutic interventions play a crucial role. Habit reversal training, a form of cognitive behavioral therapy, is one of the approaches used. Additionally, the self-help technique known as decoupling has shown promise. Decoupling involves engaging in an alternative behavior whenever the tension triggering the compulsion emerges. This intervention aims to disrupt the connection between the emotion and the compulsive action, providing a pathway to regaining control. Although medications aren't typically used as a standard treatment for dermatillomania, there's emerging evidence suggesting the potential efficacy of certain supplements. Inositol and N-acetylcysteine, both available over the counter, have demonstrated potential in addressing the symptoms of compulsive behaviors. Beyond conventional approaches, alternative therapies have also been explored. Yoga, aerobic exercise, acupuncture, biofeedback, and hypnosis are among the options that have garnered attention. These approaches recognize the mind-body connection and seek to address the underlying emotional triggers through holistic means. In conclusion, understanding the intricate nature of dermatillomania sheds light on the challenges faced by individuals grappling with this disorder. From the compulsion-driven behavior to the potential psychological distress, dermatillomania's impact is far-reaching. The recognition of this disorder within the DSM signifies the importance of addressing it with compassion and evidence-based interventions. As we continue to expand our understanding of compulsive behaviors, it is my hope that those affected by dermatillomania find effective avenues for support and management. I trust that this comprehensive exploration has provided you with insights into the complexities of dermatillomania and its associated management strategies. I eagerly anticipate our next interaction, where we can delve further into the intricacies of mental health and well-being. Our journey doesn't end here. It's a stepping stone to greater awareness, compassion, and growth. Until we meet again, remember that every step toward understanding is a step toward a more compassionate world.